Hi everyone, this is Divya from Quickmommyhacks, and today we will talk about endometriosis and pregnancy. Endometriosis is often diagnosed in women who are in their 30s, and it's often linked to painful periods, excessive bleeding, pain during intercourse, and also infertility. Today we have Asha Mathew with us. She's a mom to a 15-month-old, and she will tell us about her journey of finding out about endometriosis and the implications she had on her pregnancy and fertility. Hi Asha, how are you?
I'm good. How are you?
I'm good. Thank you so much for joining us today to talk about endometriosis and your pregnancy journey. It's good to have you.
Thank you.
So, why don't you start by telling a little bit about yourself?
Well, my name is Asha Mathew. I am right now working as a regulatory affairs manager. Well, I grew up mostly in the Middle East, in Qatar, and I came to the United States to go to school for my grad school, and I've been here ever since. So I got married 5 years ago to Ablash Matthew, and right now I have a daughter, Minerva, and she's 15 months.
When did you find out about your endometriosis? Was it before the pregnancy or when you were trying to conceive?
I found out way before, even before I got married. So the first time it happened, so growing up, I never really had any issues with my periods. Always had regular periods, no problem. And then I was in my final year of grad school. I had this excruciating pain in my lower abdomen. And so my friends, that time my roommates, took me to emergency room because they thought something was happening to me. So they took me there. They did a few tests. I think they did like a surface level ultrasound. And they didn't really, I guess they found something, but they didn't really feel that it was that big of a deal. So they gave me painkillers, sent me home. It went away in like, I would say 5 days. The pain went away and I was fine, moved on. Um, 2 months or 3 months later, I was kayaking with one of my friends and I had the same exact pain, but even worse. And so this time I was in the water on a kayak and I felt like I was going to faint. I could not stay, and she had to like get me to the shore, and immediately we went to an emergency room again. And at that point, when I got to the emergency room, my blood pressure was like 90 but not readable. The doctors had to come out. It was really bad. And so they did a whole lot of tests. They did a vaginal ultrasound, and they found out that I have a cyst that was 9 centimeter big. So at that point, it was really big. And the reason why I was having this pain was the cyst was getting torsioned, or it was turning,
Mhm,
or moving in such a way that it was touching the rest of my organs, and that was
mhm,
causing a lot of pain. So even then, they didn't tell me the name endometriosis, so
mhm,
I didn't know. So they told me go to a gynecologist, find somebody who can help
mhm,
you. So I did. So a month later, I went to a gynecologist. She said, okay, what you need to do is get an ultrasound done a month later when you have your period, so a week after
mhm,
your period.
mhm,
And at that time, I was getting married. So a month later was my wedding. So, during the wedding preparations, I told my mom in India that I need to get an ultrasound. And,
mhm.
like any other mother would, she was like, no, don't worry. It's the wedding time. Why do you want to do all that? Don't worry about it. You're fine. There's nothing wrong. And that was it. I didn't really care about it after that. I was like, okay, this is fine. My mom said it's fine. So moved on. 2 years later, we started trying. I started getting
Mhm.
this really bad pain on my left side. And that's when, we were like, okay, why do I have, first I thought it was um, something to do with my diet, like I was getting gas or
Mhm,
something. So we went and got treatment for that, but it
mhm.
wasn't that, it never went away. Then eventually I was going to go see a gynecologist, but then I had my miscarriage. So
Okay.
when I went in to see the gynecologist to do my miscarriage and all that process, they found out I had endometriosis and I had a cyst. That's when I really kind of got to know the name and kind of was like, oh, this is what I had. It wasn't just a cyst that would go away. It was really
Okay.
something bigger than
Mhm.
that, So that's how I think nobody really gave the name endometriosis up until I had my miscarriage.
When they actually found out about your cyst earlier, did they ever mention it to you that it could be a problem, when you're trying to conceive, or it could become a problem afterwards?
No, so they never really told me it would affect, my fertility or conceiving, any of those things. So at Brigham and Women's, the only thing that they told me was this could go away.
Mm-hmm.
So sometimes when you have endometriosis, they shrink on their own.
Mm-hmm.
So they told me it could go away. So in my mind, I'm like, oh, and considering what my mom said and what they kind of predicted, I thought, oh, maybe it will go away. And when
Mm-hmm.
you don't have any pain for the next 2 years, you just assume that it would go away.
Mm-hmm.
So nobody really told me it would come back or it would affect my fertility or conceiving or any of those things. No.
So besides the excruciating pain that you were having at that time, did you have any other symptoms?
I've heard that a lot of women have irregular periods when they have endometriosis, but for me, I didn't really have any outside indication except for when the cyst torsioned and that caused pain.
Okay.
So that was it. And then 2 years later, the cyst became 12 centimeter big. So it was
Mm-hmm.
really big at that point.
Mm-hmm.
So then I had the pain on my left side, which was the
Okay.
only indication that there was something going on.
And
Yeah.
considering the size of your cyst, were you given any medications, or was it just told to you that it'll go away with time?
Prior to miscarriage, they thought it would go away. Um, and, nobody did anything. They didn't give me anything. They just gave me painkillers and sent me home and told me to follow with a gynecologist.
Okay.
Um, Even after they found out with the miscarriage that I had a 12 centimeter cyst, they were really concerned because at
Mm-hmm.
that point it was so big. So at that point, it's like a water balloon.
Mm-hmm.
So it's a cyst that's filled with blood.
Mm-hmm.
So the doctor was really concerned because if it burst inside me, that would literally kill me
Mm-hmm.
because it's a lot of blood that could fill into
Yeah.
my cavities, kill my organs, and all that stuff. So she was really concerned. So that's why within the next few weeks, she wanted me to have a surgery. So I had it, I think, 4 weeks after I had my miscarriage, I had the surgery. We
Okay.
didn't wait too long.
Mm-hmm.
Yeah.
So, when they found out about your cyst and also about like gave you the name of endometriosis, did they tell you the implications that it could have on your pregnancy, or the complications that you might have in the future if you tried again?
So one of the doctor did tell me that some women do have difficulties getting pregnant. She was, although she said, told me, it's hard. There could be issues. It may take longer than what would take for a normal person to get pregnant. She was really optimistic because I already had a miscarriage, and so for
Mm-hmm.
her, she thought that, well, your body was capable of getting pregnant. It just didn't
Yeah.
stay because you had a cyst.
Mm-hmm.
So personally, in my case, the doctors were very optimistic that I could get pregnant again because I already
Mm-hmm.
did once with the endometriosis.
Mm-hmm.
So for them, it was like, okay, you had it, you got pregnant still, so you could have pregnancy again with no cyst, and this would probably be more viable than the previous one.
Mm-hmm.
So yeah, they were very optimistic, but at the same time, I think my doctor really did tell me it could take longer, and
Yeah.
we have to try and see how it goes, but
Mm-hmm.
she was really optimistic.
So, can you
Yeah.
describe a little bit about your journey when you were trying to conceive the second time after your miscarriage?
So the second time, it took us about a year, and I would say a year and a half to get pregnant. So the first few months after the surgery was obviously not the easiest to try and
Mm-hmm.
conceive. There's obviously the pain from the surgery and just having miscarriage. Emotionally, it's just not the
Yeah.
right place.
Mm-hmm.
So the first few months just wasn't the greatest, but eventually I did try and do a lot of things to, I guess, proactively understand my cycle. So I followed, try and test for when is my cycle, when is the peak time, when is the time I should have sex, and those kind of things. Like I did follow a chart, not just a phone one, but I did do, testing to see when is the right time in my cycle to have sex and conceive. So I guess I went a little, I don't know if went overboard, but I did try to be more proactive about it a little bit. And even then it was hard, because even then it took over a year. So after a year, my doctor said to go to a fertility doctor. And so she did a few of the tests. She said, she looked at my eggs and she said, you do have eggs, you have the potential to get pregnant, so there's nothing wrong with your system. And I feel like those kind of talks with the doctor kind of helped me get a little more confident too. So I think that helped after like a year of, just trying to figure it out myself. But I did do a lot of things proactively, just to make sure that I'm just not, being discouraged, or like not just following an app, but trying to figure it out physically, like myself. Doing, if I have to do it every day, I would do it every day, for a whole month. so yeah, I think that was really helpful for me to kind of figure out my cycle, and also have conversations with the doctor. And one of the things I did as I was trying that whole year, I did go to the doctor very often to get ultrasounds done. So I would, every like 2 or 3 months, I would go and see if there was more cysts coming up. And if a cyst was there, the previous ultrasound, did it go away or not? That's one of the things I did a lot in that year. I did go and get a lot of ultrasounds done. So it was hard, obviously, to go so many times, but I felt like it was important, because if I'm not keeping up and seeing if there's another cyst growing, it's, all of this work that I did towards getting pregnant is really not gonna, come to fruition. So I did go in, even though it was hard to get vaginal exams every like few months, I did go in and get multiple ultrasounds till I got pregnant.
And were there any other kind of treatments that were done by the doctor?
One of the good things about the surgery is that the way my doctor, the doctor who did my surgery did it, was they shaved off the portion of the ovary that had the endometrial cells. So he did that because he didn't want it to grow back again, or have the chance to grow back again. So that was the reason he told me after the surgery. He said, I shaved off the portions that, there's no chance, there's no more endometrial cells left. And I think that helped a lot, because I feel like a lot of times they take out the cyst, but the portions of it remain and that grow back again. And I've heard that a lot. So I think that helped with not having cysts grow from that same location. But then there was smaller cysts that did come and go every month. So, but that didn't really affect anything. It didn't affect the pain. It was too small to, take up any space. So it was good.
So how long did it take you to get pregnant again?
I would say about a year and a half. Yeah. After the surgery. So totally maybe like 2.5 years.
And like, how was your first, second, and third trimester like?
Okay, so my first and second was great. It was no problem, no vomiting, nothing. It was awesome. It was great. But I don't know if I had all the complications I had because of my endometriosis history, but my last month to the month and a half towards the end of my pregnancy, I had, I don't know if it's a complication, but so I was getting dilated way quicker. So by 34 weeks, I was 4 centimeter dilated. And at that point, they put me in the hospital. So I stayed in the hospital for a whole week. They were scared to send me back home. At that point, they said, if you're 4 centimeter dilated, that means you were in active labor. So you have
Mm-hmm.
to be in the hospital. Stayed there for a whole week. Nothing happened. Um, I went back. So the senior doctor at the hospital said, okay, we'll send you back home, but you have to be really careful. Go to the nearest emergency room the moment you feel anything. And at that point, I was 4 centimeter dilated, and I also had contractions every 10 minutes, but I couldn't
Okay.
feel it.
Mm-hmm.
So, and then a week later, so I go home. A week later, at 36 weeks, I develop something called cholestasis.
Okay. Mm-hmm.
It's very rare for women to develop it. It's a They say it's a liver condition where
Yeah.
your pregnancy hormones causes intense itching on your
Mm-hmm.
skin without any rashes, and it's painful. The the itching is it's intense. When they say intense, it's intense. So it was really bad. I went back to the hospital and I got admitted for another week.
Mm-hmm.
So I think I went to the hospital at 37 weeks at that point because I was home and I was itching a lot. Went to the doctor. Doctor said, you should not be walking around like this. You should be in the
Mm-hmm.
hospital. She sent me back to my hospital. I
Mm-hmm.
was there for a week. And the thing with cholestasis is because it's so rare, there's not a lot of tests
Yeah.
to find
Mm-hmm.
it. So the test takes a week to come back. So you send the blood in on a Monday. So I was admitted on a Monday. They sent the blood in on a Monday. The results will come only on a Friday. So if you have cholestasis, you need to get induced. That's
Yeah.
how it
Mm-hmm.
works.
Mm-hmm.
So they waited upon the Friday, but Friday morning my water broke
Okay.
and my labor was just 3 hours
Mm-hmm.
because I was already 6 centimeters dilated
Mm-hmm.
and I wasn't feeling any contractions up until that point. So I had no pain.
Mm-hmm.
So when my water broke, I went from no pain
Mm-hmm.
to a 6 centimeter dilated pain in like seconds.
Mm-hmm.
And then I had my delivery in 3 hours. Like she was out in 3 hours. So I don't know if because the cyst, my pelvis was stretched because
Mm-hmm.
the doctors kind of told me that your pelvis doesn't look like it's a first time mother's pelvis.
Oh, okay. Mm-hmm.
It looks like somebody who have already given birth. And that's why it
Okay.
was dilating quicker.
And then after post-pregnancy, postpartum phase, did any of your endometriosis symptoms, did they return? Any kind of pain or any kind of other complications that you had?
I haven't still had any pain, which is great. And it's been a year. She's 15 months now, so a little over a year now. I do have to go back and get checked again to see if there's anything growing, because one of the things with my case was that there was no outside indications even before.
Yeah.
So
Hmm.
if there is anything growing, I really have to go to the doctor and get it tested to see if there's anything. So
Hmm.
up until now, there's no outside physical indications now.
So, like now, you've had those kind of experiences. Now you're more aware and you're more proactive as well. So, based on your experience, like what kind of advice would you give to women, who are trying to get pregnant or who are pregnant and, women who have endometriosis? Do you have any advice for them?
I would say be proactive, because a lot of things that, even before, if you feel like there is some kind of constant pain on your left side, right side, back, make sure you go to a doctor, because I feel like I didn't do it in the first, I mean, for close to a
Hmm.
year, and that didn't turn out really great. So I would say be proactive, even if it's before marriage and you find out something like this, you can do a surgery, you can get it removed. And
Hmm.
there's obviously more complicated levels of endometriosis, but if it's
Yeah.
something like me, you can actually have a better chance of having a baby without any complications if you do all the other hospital and surgery stuff
Hmm.
beforehand. So
Yeah.
even if you're not married, or you just got married and you feel like you have pain somewhere and you really
Hmm.
need to go see a doctor, do it.
Yeah.
Don't wait, because that's not going to help anybody.
No, I think you have raised quite important points about being proactive and always being aware and not ignoring any kind of symptoms, whether you are married or not married. So I
Yeah.
think those are really, really good points. And we want to just thank you for, for being here and discussing your pregnancy journey and also giving us a lot to think about endometriosis as well. Thank you so much.
Thank you for having me. Thank you.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram for some personal tips on pregnancy, childbirth, and motherhood.